November is World Pancreatic Cancer Month, and when it comes to the fight against this disease, knowledge is power. Julie Fleshman is the president and CEO of the Pancreatic Cancer Action Network, and she joins us now with more on this topic. Julie, good morning to you.
Good morning.
So this month, a big reminder of what exactly pancreatic cancer is. So let's start with those basics. What exactly is it and how common is it?
Sure. So pancreatic cancer is one of the deadlier forms of cancer. It's the third leading cause of cancer death in the United States. Over 60,000 Americans will be diagnosed with pancreatic cancer this year, and that number continues to go up every year. And unfortunately, the 5-year survival rate is just 10%. So PanCan is working very hard to raise dollars, invest more in research, both for early detection and better treatment options for patients.
Yeah, and that impact seen here locally, not at our station, but an affiliate where someone lost their life to pancreatic cancer. So what are some of those signs and symptoms that people really should look out for?
Yeah, so one of the things that makes pancreatic cancer challenging is there is no early detection test for the disease, and the symptoms are quite vague. So things like lower back pain, stomach pain, irregularities in your stool. One of the more visible symptoms is jaundice, which is yellowing of the skin in the eyes. And we also now know that new onset diabetes can be an early symptom of pancreatic cancer. So we want people to be aware of these symptoms so that when they're not feeling right, they can be an advocate with their doctor.
Are there steps that people can really take to assess their risk then and take action?
Yeah, so one of the things we're talking about this month is testing. So testing for patients after someone is diagnosed with pancreatic cancer, PanCan recommends that all patients get both genetic testing and biomarker testing of their tumor tissue. And that information will help them to determine which treatment option may be best for them. For family members of someone with pancreatic cancer, so in first degree relatives, so a mom, a dad, a sister, a brother, or a child, PanCan recommends that they talk to a genetic counselor to better understand their family history of pancreatic cancer and determine whether they should get genetic testing to better understand their risk of the disease.
And as we mentioned earlier in this interview, November World Pancreatic Cancer Month, the Pancreatic Cancer Day, November 18th, and that follows by Thanksgiving. Are the holidays really a good time when you have everybody together again to have these type of conversations?
Absolutely. You know, people, there's fear about getting genetic testing and understanding your risk, but PanCan believes that knowledge is power. And if you have that information, you can be your own best patient advocate. You can be in the driver's seat of your health.
So if this interview is really resonating with one of our viewers, where can they go for more information to learn more about your organization itself?
Yeah, please go to pancan.org where you can learn more about pancreatic cancer. You can learn more about the testing that we've been talking about. We also have an amazing patient services program that is available free of charge to anyone in the public. They can call and get connected to one of our trained case managers and get more resources and information. And at pancan.org, people can also find out how they can get involved in their local PanCan affiliate and make a donation.
Yeah, Purple Stride, a big event that happens, and we've been involved here and locally in Las Vegas when that comes around to be able to promote that. But we appreciate your time this morning. Pancan.org for more info like you mentioned. And as you mentioned, knowledge is power, so we appreciate your time and bringing more light onto this.
Great. Thanks so much for helping us raise the awareness.
Of course, November 18th is Pancreatic Cancer Day. To learn more about pancreatic cancer and available resources, just visit that website. It's right there on your screen. You've heard it mentioned a couple times, pancan.org. We'll also have all of this information on our website as well.